Mayfield, expert spine care right where you live. Start with us.
This pandemic isn't fully over yet, and it has already taken so much from so many people: time, jobs, livelihoods, loved ones. But the good news is experts say that this trauma we have all suffered from the pandemic is a thing we can all heal from.
May is Mental Health Awareness Month, and our partners at Newsy are bringing us expert advice on how to rebuild our mental health. Topics range from collective and racial trauma to accessing therapy. You just heard there from Lindsay Thies. She covers health and science for Newsy, and she's taking time to speak with us today. We know you're not a doctor, Lindsay, but tell us what you have learned through your reporting, starting with the first installment on PTSD and this collective trauma we share.
Absolutely. Well, good to be with you today, Julie. When we're talking about collective trauma, sometimes psychologists refer to it as collective suffering. Really, that's what this pandemic has been for all of us. We've all been impacted in different ways, but we've all been impacted in some way by the pandemic so far. So I think when people think PTSD, we typically think of this capital T trauma, one singular, really terrible event. The way that this pandemic has been so far is it is a little t trauma, meaning that it continues to go on, but it is still, in the way that our brains and our bodies deal with it, just as awful and just as terrible. But the good news is that it is something that, you know, just as if it was cold season and you can do things to protect your physical health, we can do to heal and protect our mental well-being as well.
Yeah, it's a little T, but the longer it goes, the bigger that T gets, it seems like, Lindsay. So for the parents and aunts and uncles and friends out there, what kind of concerns do doctors have for our kids, and how do we look out for them right now as this continues on?
Sure. Well, even before the pandemic, early in 2020, the numbers were not looking very good for pediatric and teenage mental health, and those trends have continued as the pandemic's gone on. One study that we reference in an installment of this series where we focus on children's mental health is that 48% of parents have noted that their teenagers have had a new mental health condition or incident spike up since the pandemic has began. The thing is, though, there are practical tools that you can use as a parent, aunt, uncle, that sort of thing. So really simple language, like using the words, how are you feeling? What are you excited about? What are you concerned about? Can be really telling, as well as paying attention to how long any behavioral changes are lasting. And the longer they last, that's when it's cause for concern. So for example, if you have a kid who's really into Fortnite and all of a sudden that interest is no longer there and they're wanting to nap or sleep more, a couple of days, maybe not a big deal. They may just be feeling a little off. But if it's something that continues for weeks or even months at a time, that's when you want to talk about a mental health screening with your family doctor or looking to a pediatric mental health professional.
Yeah, and hopefully getting to the resources, because so many parents just don't have the insurance to cover those. It's a couple $100 just to get the assessment, and that's what we're seeing. We got 30 seconds, Lindsay. Today's installment from Newsy focuses on isolation. How much longer is this an issue as we get the vaccines? Is this still going to be a big problem, do you think?
Absolutely. And really quick, as you mentioned affordability, we will have an episode about that coming up with some free and low-cost tools as well. When we're talking about the pandemic, we're still in the middle of this. And the way that our brains work, neurologists tell us for this series, is there's not an off switch. So it's not like you get full protection after your vaccination and your brain turns off a button that says, okay, I'm good.
Right.
So we have a lot further to go. And in this piece today, we talk about things that you can do to not only advocate for yourself, but to advocate for others who are close to you, kids, seniors, that sort of thing as well.
It is the single greatest concern now of so many mothers and fathers, kids, even suicidal right now, and continue to be. And so thank you for the series you're doing. Lindsay Thies, the health and science reporter for Newsy. Thank you. We've been talking about their new series that focuses on rebuilding our mental health. It's so important. You can find the stories on newsy.com. Lindsay, thank you for talking with us today.
Thank you.
All right, let's turn to our